It was late on Christmas Eve, and I stood there,
watching him, wondering if he would survive the night. I had operated on him that evening, trying to save his life so his mother could spend at least one Christmas with her firstborn son. This premature baby, barely 500 grams, fighting for his life in an incubator, while she, his mother, tenderly watched over him, praying for a miracle. And I had a revelation. Everything I had trained for was for moments like this. I'm a consultant pediatric surgeon working in one of the busiest hospitals in London, and I treat children from premature babies to teenagers. This baby had a bowel perforation, and he would have died had I not operated on him that night. When I spoke to the mother, I felt her story. A young mum, on her own, her first child, her love. She didn't even get to hold him. I knew the operation had all its risks, but it was currently the only chance to save his life. And so, after the delicate but challenging operation, we brought him back to the intensive care unit, and I stood there in silence watching. And in that moment, I knew that this was what I had always wanted to do. I was grateful enough to be given the opportunity to help and even save children by being a pediatric surgeon. But this isn't the only passion in my life. I am also a poet. For a long time, I thought I would have to keep the two separate, because surgery had always been defined as a science and not an art. At least that was the impression I was given when I began my training in surgery. Not only this, but I was also from the complete opposite demographic from all the surgeons I met when I was training. I was not an older white man. It was hard enough to fight through the preconceptions they had of me, including, at one point, being told that my place was in the kitchen. I know. How then would I be able to bring in my creative side? Would it make me look less committed to my profession? So I didn't tell anyone. It was like leading a secret life, working in the hospital in the day and performing poetry in London at night. I felt that if I revealed I had another passion, I wouldn't be taken seriously as a surgeon, that I had another love for spoken word and poetry. And so these two paths of mine separated for a while so I could concentrate on work. A couple of years later, I was visiting home, and my mum, hi mum, found some old poems I used to write as a child. And there it was, my first self-penned poem at age 10, complete with its own illustration. It was called The Killer Doctor. This was a sign. This was my epiphany. Medicine and poetry merged. I realized that the two can help each other. In fact, poetry was helping me connect things in medicine that no textbook could teach, and I started to embrace it. Just as a poet takes complex emotions and articulates them into a few phrases, medicine is the same. You see a patient, note down their symptoms, and then you put them together into a concise summary to create a diagnosis and treatment plan. Everywhere you look in medicine, there is art. And it's very relevant in surgery. The operating theatre is called the theatre because it's like a performance. Each person has their role, their character. The anaesthetist who puts the patient to sleep, the scrub nurses who handle the tools, and the surgeons who perform the operation. It's in our everyday words, we perform the operation. They each take their position on the stage. The anaesthetist at the top of the table, the scrub nurses to the side, and the surgeons positioned around the patient for the operation. And there is the warm-up, hand washing, so we prep and put our surgical gown on and get into character. And the operation is a beautiful performance. an interplay of verbal and non-verbal communication with instinct and intuition. The anaesthetist adapting the anesthetics, the scrub nurses preempting which instrument the surgeon would want next, and the surgeons, whilst operating, adapting to the sounds and the sights, the discussions and the monitors. And the operating itself, there is an art to it. No matter how much you read the textbooks, it also comes with experience and humility. Our hands are the instruments that can equally cause damage or heal. Losing 5 mils of blood to your eye is nothing, but it could be 10% of the blood volume of a premature baby. Every movement you make must have a purpose. It's about respecting the tissues. And nature has given us signs everywhere. They give us signs in our organs, and they all tell their stories. They help us in our operations, whether they're anatomical landmarks to help us navigate our way, or the tissue planes, so we know we're in the right place. Everywhere you look in medicine, there is art. We even hold the scalpel like a pen, working on nature's portrait. What we do every day is intense emotionally. We could be saving a life and then within hours losing another and then go on like it's a normal day. This can have huge psychological effects on doctors. In fact, doctors have one of the highest rates of suicide, depression, and anxiety compared to the rest of the population. And how do we cope with this? I found myself writing poetry about the things that affected me, and it helped me process things. So I'm going to share a piece with you that I wrote a few years ago. It was Christmas again, and we had a baby born with genetic abnormalities that were life-limiting. We wanted to make the last few days for this baby as peaceful as possible. And every time I walked into that room, it was always full of love and serenity as the mother spent time with her baby. And the immensity of this love had such a profound effect on me, it compelled me to write this when I got home. It's called The Beautiful Mistake. You were the miracle that perhaps life forgot, a delicate derangement of DNA, a beautiful mistake. But you chose to live briefly in the chaos of this world. Paper-like skin, your veins are visible, threads pumping dark, congested blue all around, because your heart chose not to cope. Minute fingers, intricately wrapped around your mother's own. Your eyes do not comprehend, but your senses know that you are in her arms, your perfect imperfections for her to admire and caress with love. You do not need to know that science had failed to cure you, that this was futile, because it wasn't, not in your mother's eyes. You do not need to know that the drip had finished hours ago, or the ventilation machine switched off. It doesn't matter, because you can now be held in her tender arms like you were always meant to be. And as we watch helplessly in silence, stealing the oxygen from your delicate lungs as we continue breathing with no discomfort, your struggle deepens with each and every breath, a silent cry for one more try. Your mother, your perfect angel, holds you with heartbreaking delicacy, and that's all you ever need to know. For her, you were never a beautiful mistake, only beautiful. She sings you a lullaby in the tongues of her ancestors, a gentle kiss, a tender prayer, and her only wish is that you live to feel the sun on your skin whilst you lay in her arms, just once, before your last goodbye. I have learned to embrace my creativity. It helps me connect to my patients on a deeper human level, so I truly understand them. They're not just a set of symptoms. They are people with real stories, with feelings, with needs. And we're all poets in our own unique way. Just like in a piece of music, the individual notes are like your left brain hemisphere, looking at the details. And the finished harmony of music is like your right brain, putting it together to see and experience the bigger picture. We all have creativity within us. We just have to find out what it is, whether it's painting, music, running, cooking, building, anything. Embrace it. Find your poetry. What makes you fly? What makes you thrive?